Welcome back, everyone. Now we begin with the second session. The topic for this session is measuring brain functions. And for this, may I request Venerable Geshe Doji Ramdullah, the director of Tibet House, Professor James Hussain, Dr. Champa Indillah, and Dr. Bindu Kuti to be on the stage and take their respective seats. Well, since everyone is well aware of our chairperson, Kishila, so I will not introduce again to save more time for question and answer session. So I may request Kishila to begin the session.
Okay, welcome all of you to this session. For sure, this is going to be a very exciting program, this session, and we have Dr. James here, Dr. Bindu here, and then we have Dr. Chambala here, and Dr. James, how we come to be able to get him is through Dr. Sion, and we are very happy that, where's Dr. Sion? Disappeared? Okay, so this is Dr. Sion, our collaborator, and in fact the convener of the program, the conference. So let me quickly read Dr. James Hossam's the CV, and before that, what I'd like to share with you here is the topic, measuring brain functions. The topic, measuring brain functions. In this connection, one, of course, in a very strict sense, the really measuring in the form of proper units. They say two hertz, or whatever. So this is one way of measuring. Another way is as we explain how the brain works, how the mind works, particularly from a more traditional point of view, how the mind works, how the brain works, what is happening in the body and so forth. From there, we should have the capacity to know the nuances of measuring, not in a strict sense, but in knowing as to where we are heading towards, to what intensity, less intensity, more intensity, and so forth. This is the nuanced way of understanding the measuring the brain waves, or the measuring the workings of the brain, workings of the mind. Okay, so we have Dr. James Hosam, who is a professor of biomedical engineering and directs the Institute of Biomedical Engineering and Informatics at the Technical University in Mannheim, Germany. His research interests include the investigation of the active and passive bioelectric and biomagnetic phenomena and medical technology for ophthalmology. Okay, so I welcome Dr. James, and as the moderator rightly pointed out, please stick to our time duration so that the audience are so excited to go for quick answers. So I ask all the presenters here to stick to your time. Thank you very much.
Yeah, thank you very much for the introduction, and thank you very much for inviting me here to this very exciting event. It's been so far already very inspiring, discussing with my colleagues and having first interactions, and I'm surely hope that I will have lots of more interactions with the audience and with all the people here in the room. I would like to take you on a short journey to the engineering topics, the topics how we measure brain activity. And it is, in this case, really the brain activity. That means we measure what the neurons are producing. I would like to introduce two of those measuring techniques to you. One is called magnetoencephalography, and the other one is called electroencephalography. Professor Seon already talked about electroencephalography in one example in his talk, and I would like to go a bit more deep into electroencephalography in order to show you what is the current state of technology and what to expect in the upcoming years, what are the new trends, so to say. And then I would like to close with a study which brings us then to the mind, which brings us to some of our usage of this technology, in this case magnetoencephalography, for discovering actions in the brain and relating them to the mind. So magnetoencephalography is a technique which measures with the help of magnetic sensors surrounding somewhere the head the activity coming from the inside of the head. Inside of the head means we have some electric currents flowing in the neurons. We have electric currents, which is indicated here in the lower part of the picture, in the neurons, in the glia cells, and basically all around those cells as well. And that current produces at the same time, of course, an electric and a magnetic field. And you can measure both. The magnetic field is measured, and then the term magnetoencephalography arises, and the electric field is measured, and then the term electroencephalography arises. Unlike magnetic sensors, which are typically positioned a bit away from the head, electric sensors, electrodes, are positioned directly on the scalp. You see this here indicated by the two arrows on the body surface. And that same technology is of course also used in other fields like electrocardiography, electromyography, and so on. It is important to note that although we have the same current, the same electric activity inside the body underlying both measurements, they see different aspects of this current. So they are not the same in terms of sensitivity, they are not the same in terms of measurement aperture. It is only when you combine them that you get most of the information out. So now we have a few difficulties to address. For magnetoencephalography as well as for electroencephalography, the signals are very weak. That is technically a challenge. So to give you an example for the magnetic field, what you can see here is that we have typically around 10 to the minus 15 to 10 to the minus 12 Tesla as a magnetic field, or magnetic induction to be correct. And when you see what is surrounding us, so say for example the light up here in the room, the beamer which is sitting there, they have much higher fields by themselves than all of you have right now at the moment. This field is surrounding you every day, every single minute. But those other fields are much stronger, as you can see there in the micro or millitesla range typically. Even a car which is 50 meters away, it's much stronger than the signal produced by your brain. And if you think of functional MRI or magnetic resonance imaging as such, that is even higher in the order of 3 Tesla. So this poses two challenges. First, very sensitive sensors, and second, you have to shield to get rid of all of these disturbances. The first measurements for magnetoencephalography were done back in the 1970s. Back then with a very large coil, you see the one here on the left side, a very large coil which was able to do the very first recording actually. Nowadays we do this a bit more sophisticated, so you can see in the last roughly 50 years technology has evolved. Nowadays you can see the helmet here on the side with the young students sitting in the helmet, and you measure basically the magnetic field all around the head with typically around 300 sensors. That is a rough indication. It depends, of course, on which company, which device. Electroencephalography has similar problems, but not as strong as magnetoencephalography when it comes to the size of the signal. What you measure here is a potential difference, a voltage on the head. That is in the order of microtesla. So it's still a small quantity, and also not easy to measure, but it is much more convenient compared to magnetoencephalography. Electroencephalography is having also a longer history. It goes back to the 1920s. This person here on the right side, his name is Hans Berger. He was the discoverer of the electroencephalography back then in Jena in Germany. What he used at the time are electrodes like this. Those are needle electrodes. And those needle electrodes are put underneath the skin. So you stick them basically into your patient. Something we would typically not do nowadays. Nevertheless, it was the method of choice back then. One of the reasons was that technology was not advanced enough to give otherwise recordings. So I would like to show you in the next video how a typical situation in an EEG lab works nowadays. So what you see here is actually 3 of my students, and they are preparing such an recording session. What you can see is that the subject is wearing a cap. This cap has electrodes. You can see the outside plastic cover of the electrode here. Those electrodes are filled with paste or gel, then after a while, in the worst case, with the 256 electrodes system, which Professor Sion presented, it can be even up to 3/4 of an hour, even if you have 2 people handling it. Then you can start your actual recording. And it is important to note here that this type of technology, which is the standard nowadays, has to be performed, has to be taken into practice by people who are knowledgeable about this. You cannot do this at home, in other words. So when you're done with the recording, as you can see here, then you take off the cap, and what you can see right now is that some of the material is still sticking there. In this case, we even lose one of the plastic holders on the skin. Yeah, she's not very happy at the moment because she has to wash the hair in the next step. So now I would like to show you what we are going to do about this. So what you see is here a prototype of a new electrode cap, one which we developed in our laboratory. And first thing to note is that you are doing this, you're seeing this first of all in the living room, actually the living room of that student. So she's now having no assistance, doing it completely herself, doing it in her living room. And of course, being able then to connect to the outside world. That means her recordings can monitor it somewhere else, which helps, for example, telemedical applications, or which can help monitoring in a broader sense than just medical. So what you then, of course, obtain is a set of data. Data which are typically then interpreted, as you can see here with the two students trying to make sense out of what they're seeing. Typically, it's not done like this, just pointing on the screen. Typically, we have some algorithms to extract the actual information. Yeah, once you're done with the recording, you put the thing back in place and deal with something else, enjoy something else. So this type of electrode, which you see here, is distinctively different and enables something which we will see hopefully in the future as a sort of a revolution for electroencephalography. Electroencephalography done everywhere. So I would like to introduce some of the typical concepts. What is the state of art? What is the state of research in that field? So we have, first of all, two different main concepts, which is contact electrodes and non-contact electrodes in general. The non-contact electrodes are typically not so much used in electroencephalography due to the hair which most of us have. The contact electrodes have three different types. Wet electrodes, those are the ones from the first videos, the dry electrodes, the ones from the second video, and then there are hybrid ones, I will show you in a minute. So the wet ones are the ones like you see here. Those are standard electrodes. They have been around for 50 years roughly, and they're used all over the place. The one on the right side is the one which was used in that cap actually, and the small pin which you see there in the upper part is actually the electrode. Then you have disposable ones. This is what you have seen probably when you visited a doctor. Those are standard electrodes for recording heart activity typically. Then we have so-called microstructures or microspike electrodes. You can see microscopic views here. This is a development of the last, say, 10 years. Those microspikes are able to penetrate the upper part of the skin, so they are used in areas also without hair. And they have one advantage: they have better contact because they penetrate the upper layer, the first micrometers of the skin. But they have the big disadvantage that some of the spikes actually break and then stay in the skin, which you don't want. Then we have dry electrodes. There are a few designs out nowadays, and it's not yet clear what will be the standard in 5 years. You have two different, first of all, you have rigid designs. Those are typically metal electrodes. The one in the middle is one from our lab, and those metal electrodes are very nice in terms of getting contact to the skin. They have one big disadvantage: they're a bit uncomfortable if you wear them for a longer time. That is simply because they're putting too much pressure, they're not flexible, they don't bend. The flexible ones can be distinguished between real flexible ones and semi-flexible ones. The one here on the left side is the one you've seen in the video before. And there are two other versions which you can see here from our competitors, a lab in the US and a lab in Taiwan. And then we have really flexible ones, but they're not really useful for EEG because of the hair again. So they're sponge or bristle ones, as you can see here. Then we have hybrid electrodes. Hybrid electrodes are electrodes which are sort of using the felt pen principle. So you have a stick that is sort of felt pen material, and then it is wetted with some conductive material, and that makes contact to the skin. They make nice contact, but they're quite difficult in preparation and also difficult in handling once you put more of them. It's nice for one, but not very nice for more. The same holds actually for this cavernous electrodes, where you have a small cavern inside, and then there's a liquid inside, and that is released in order to improve the contact of that electrode. Again, very nice for a single electrode, but not nice for many. And then we have the so-called capacitive sensors. They are a first type of non-contacting sensors, and they are used typically more, again, for the heart compared to the brain, because the more distance you have, the more hair you have in between, the less well they work, actually. And finally, we have also some electrodes which are typically used only for invasive recordings. Those are optrodes or photrodes. They are used if you're able to put some color, some dye into your material, well, slash the brain in this case. So those are the principles out there. And as I said, it's unclear what will be the commercial standard in 5 years or in 10 years. But you can see from the variety that there is a lot of development going on, and that we will end up in having mobile EEG. That is very clear, I think. I will show you shortly one small study we did in order to convince you that those dry electrodes are really doing the job, because it is a novel technique. It is a technique which has not been used around in many labs. And therefore we actually tested the novel dry electrode cap, pretty much the one you've seen in the video, on 20 volunteers with a comparison to a standard wet cap. In this case it was a 120 channel wet cap and a 97 channel dry cap. The 97 channels might be a bit unusual, and that is simply because of the fact that for the specific design we were not able to fit more of these electrodes on it, which was corrected afterwards, but not for the study. Yeah, we did sequential recordings, so the people were wearing first the dry cap and then doing recordings, and then the wet cap and doing again recordings. What kind of recordings do we do? For example, so-called visual evoked potentials. And that means you see a checkerboard in front, as the subject sees here, and the white go to black and the black go to white, so you see a flickering of that checkerboard, and that produces a very nice activity in the brain, which is used as a sort of a standard to test brain activity, to test your visual function, basically. Another one which you typically also do, and what Professor Sion already mentioned, is the so-called alpha activity. Alpha activity arises as soon as you close your eyes. Then the brain starts to produce, especially here in the back of the head, in the occipital part, this alpha activity. And what you see here is already the first comparison. So you see the average overall of our subjects, all 20 people are going into that curve into that topography. And you see the dry in the orange type of line and the blue one in the wet. What you see is that the lines are very much aligning, although they're not simultaneously recorded. Remember that they're recorded sequentially, right? And also the respective maps, which you see here over the head, they're very much aligned. So there's not much difference, actually. There's no significant difference except for some places at the zero line. The visual evoked potential, which is sort of a standard test, basically, you can see here on the left side the conventional wet electrodes, on the right side the dry electrodes. And what you can see is that both the curves as well as the topographies in the lower part very much align between the wet and the dry electrodes. So with this, I think I can hopefully convince you that these dry electrodes are actually doing the job. What we also found with this cap here in the lower part is that we still have some issues to deal with. For example, uneven pressure distribution. If your head is, say, bigger than other ones, then you might have a bit of an uncomfortable situation around here. and so we have to go and improve the mechanical design of that cap in order to equalize the pressure all around. And we will go and build actually a 256 channel cap early next year in order to compare it then to Professor Sion's data. So with this I would like to leave technology for the last part of my talk and would like to give you an example of an application study which we did a while ago. That's a short study, don't worry. So this study actually came up into my mind quite some time ago when I was talking with musicians. One thing they told me is that when they are listening to a well-trained piece of music, then they can feel sort of associated movements, even though they don't move, but they feel sort of, my fingers move in the same way as I would when I played this piece, right? This is a question of training. So it doesn't happen if you play the piece just once or if you play it just off the paper. It has to be a really well-known piece to you, well-trained piece. So the question which came to my mind was, is there actually involuntary motor activation without the actual movements? Involuntary means that you're not aware of this actually. And then of course, which parts of the motor system are involved? We heard earlier the motor system is in the brain at different parts, so it's not just one area in the brain, it's a number of areas. So what we took as an approach, we recruited pianists and non-pianists, and we presented them well-known pieces. There was a rating before in order to make clear that this is the case. And then they got a task which is completely unrelated. Namely, they have to address differences between right and correct notes in that piece. And then we examined the differences between the pianists and non-pianists. So what are the non-pianists? This is the crucial question here. They have to have an musical experience. And we have chosen there actually singers. Singers from the university chorus with the same amount of music experience, but no instrument experience using their fingers. So then we played them stimuli. I have two examples here. This is the correct one. I guess this is also known to most of you. Now we have a wrong one. Which is this one here, and if you look at the note, you will immediately recognize what. If you So that's easy. All of our subjects were immediately able to tell this is a wrong piece. So what did we do? We throw away all the wrong pieces. All of the information is gone. We just take the correct ones, and then we analyze all the different pieces with respect to two properties, namely the ones which are played with the thumb and the ones which are played with the little finger. And there's a specific reason for that. The thumb and the little finger in the primary motor cortex are the most distant. So they have a distance of about a centimeter. And so if the primary motor cortex is involved in that, we should see that difference actually. And this is what actually also comes out when you look at the sensor level, so the recorded data. And we look now at the difference between the singers and the pianists. you see just one blob showing up. And this is here over the left side, which means the right side, which is the right hand. I forgot to say that it was about the right hand here, actually. When you then use lots of technology to actually have a look at the brain activity from that recording, then you see that for the ones played with a little finger, you have a location, which is indicated here by the red spot on the left side, which is more upper compared to the one on the right side, which is played with a thumb. And that is exactly the expected difference. What you also can see here, there are no activities in the other motor areas. Well, I tell you, you probably don't see it right away, but motor planning and other areas which are typically involved are not activated here. So there's no difference. So that means, in conclusion, we do have involuntary primary motor activation, no secondary activation, no planning activation whatsoever. So it directly goes from auditory processing to motor execution. And that is a conceptual binding, what we find here. A binding where you bind the concept of your perception, of your auditory perception, to immediate execution. And that happens only if you train long and well. With this, I would like to thank you for your attention and my co-workers.
Thank you very much. Dr. James, we'll have questions and answers maybe a little later.
Okay.
Yeah, thank you. So next we have Dr. Samir. In fact, he's one of the best doctors I know very closely, and he's very active in many ways. So Dr. Samir is the founder of Tibetan Healing and Wellness Center, Bangalore. He is a gold medalist from Indian Board of Alternative Medicine, Kolkata, in the year 1999. Dr. Yandin worked as physician in residence at Chapuri Tibetan Medical Clinics and also at Chapuri Pharmacy Department, Siddipura. He travels to different countries for giving teachings, workshops, and healing retreats on Tibetan medicine. So I now take the floor to Dr. Yandin. So what I request is that we have Dr. Yandin has 25 minutes, and then after 12 minutes, I will signal you. Okay. Please, Dr. Yandin.
Touch the leg. First of all, I would like to thank Keshila for giving me this opportunity. My topic is the Tibetan medical system of measuring brain functions. As Dr. Jain has just spoke about, according to the Western or neuroscience, we also have traditional way of measuring the brain function. But before that, I want to do my prayer. First of all, I would like to offer prayer for Medicine Buddha. Okay, first of all, I would like to offer a prayer to Medicine Buddha. So this is very important to offer prayer for all sentient beings. After offering the prayer, I have some contents. If you look at it, I would like to talk about the origin of traditional Tibetan medicine. Traditional Tibetan medicine is form of integrative medicine. It is mainly based on Buddhist philosophy and born traditional. Traditional Tibetan medicine is influenced mainly from neighboring countries like India, China, and Persia. Traditional Tibetan medicines are made of mainly based on herbs, minerals, and animal substances. Since we came to India in 1959, we stopped using animal substances. There are few reasons. First of all, there are many diseases coming from animals, like bird flu or swine flu, so on. Second reason, there are many people who are vegetarian who don't eat meat. And the third reason, we have substitute plants also. Anyway, so most important thing is traditional Tibetan medicine treats not only the symptom but the cause. Then I would like to focus a little bit on the concept of traditional Tibetan medicine. In traditional Tibetan medicine, there are 84,000 mental afflictions. So all the disorders are not depend on body and mind. It is depend more on the emotional levels. These disorder can be summarized or condensed into 404 disorders. These 404 disorders can be categorized into 4 parts. 101 karmic disorder, 101 spirit disorder, 101 miscellaneous disorder, and 101 disorder based on Lung, Tiber, and Pagan. I want to briefly talk about these 4, which are very important. It shows, as I told you, it's the integrative medicine which has the influence from Indian Ayurveda medicine, Chinese medicine, and Persian Unani. But it has its own unique, which is based on Buddhist philosophy also. So here, the karmic disorder in Western medicine or neuroscience, they talk about genetic, everything they used to see the genes. Likewise, in Tibetan medicine, we see the karmic disorder. So I practice in Bangalore, and I would like to share one of my clinical experiences. These days, the most problem in Bangalore, the disorders are based on cancer, infertility, and stress. So I would like to share my experience with infertility. Many couples, young couples, they get married and, so they are not ready to conceive for a few years. Once they are ready, they are not able to conceive it. So they go to their regular doctor. They ask them to do the blood test and everything. Everything is fine. The menstruation, the menses is fine, the bloods are fine, uterus is fine, the sperm is fine, but still not able to conceive. And then they come to me. So in our medical text, the Geshe, it stated, Le Manzunan, if the karma is not there, so the karma between the husband, the karma between the wife and the soul or the child, to enter, we need that karma. Without that karma, even though if you are physically, like the blood, the sperm, the uterus, everything is also fine, not able to conceive it. So in our traditional, we have a way, we have a solution for that. So we try to help them to change the karma through some spiritual activities like chanting, meditation, prostration, offering the pujas to change the karma. And we suggest them to go to pilgrimage to the holy places. So then it changes the karma and they're able to conceive it. Are you able to believe that? And there are many I have cases, who have conceived with this, with such spiritual activities. Anyway, so like that, there are 101 disorder which are called karmic disorder. And then the second one is spirit disorder. There are 101 spirit disorder. I would like to share one of my teachers, his experiences. My teacher, my name is Dr. Tokawa Rinpoche. He passed away in 2007, one of the greatest Tibetan, physician, Amchi, in exile. So during Rinpoche's visit to USA in early 1980s, while he was seeing the patient in Colorado, one scientist was suffering from cancer. I don't remember exactly, it's a blood cancer or liver cancer. So he came to see my teacher. So my teacher did diagnosis, like seeing the pulse, the urine analysis. And then, my Rinpoche told, did you pick up any stone from the forest? And the scientist said, no. So Rinpoche prescribed the medicine, and Rinpoche told the scientist that if you find any stone, bring it to me. And next morning, the scientist came with a stone. He brought the big blue turquoise, and he said, yes, I found this stone and I picked it up from the mountain. So Rinpoche told, your cancer is caused by the spirit. Because, when you pick up the stone, the spirits are living under the stone. So they got angry and they attacked you and you got the cancer. So Rinpoche suggested him to go back to the place, keep the stone. And then he took the treatment for 3 to 6 months, and then he got cured. So see, how this karma, the spirit, how it works. But the important thing is we need to be open to our mind. We need to understand the disorder in a very holistic way. So there are many, I have a clinical experience also, but shortage of time, I'll not go too long. And the third one is miscellaneous disorder. So I always joke during my talks, normally when women carries the bag, they put lots of makeup. But these days, instead of makeup, you can find lots of medicine. Whenever we have any pains, like headache or fever, we never try to analyze what caused our problem. We just try to take the painkillers. And then we suppress our disease. And then one day when we go to do the ECG or scanning, we have a brain tumor or some cancers. So in our traditional medicine, the miscellaneous disorders, when we get any problem, instead of taking medication, suppose if I have a headache, I should analyze, did I sleep well last night? Did I drink lots of alcohol? Did I think a lot? If you analyze and if you see the cause, instead of taking medicine, you just try to, if I'm thinking too much, try to relax. If I drink lots of alcohol, drink some water and, try to overcome that instead of taking medicine, then we can heal. So these are called 101 miscellaneous disorder. And the last 101 disorder, which are based on long Tibetan pagan. So in traditional Tibetan medicine, all our problems are based on long Tibetan pagan, which are translated as wind, bile, and flame. So therefore, the lung has 42 disorders, Tibetan has 26, and pagan has 33 disorders. The total is 101 disorders. And then all these disorders can be condensed into just 2 what is called disorders. So like anyone who are familiar with, I think every one of us are familiar with Indian Ayurveda. They have 3 dosha, Vata, Pitta, and Kapha, which are very similar to traditional Tibetan medicine, long Tibetan pagan. So many people ask me what's the difference between Indian Ayurveda and Tibetan medicine. I went to Jamnagar, Ayurveda University to study. Yes, theoretically it looks very similar, but the depth of these two are very different. Ayurveda is more like modern science, more really about the physical and mental, but Tibetan medicine is more about, emotional. So, and then more spirituality based on Buddhist philosophy, as I mentioned in the beginning, and also related to the what you call indigenous, traditional one also. Anyway, so then same like that, this hot and cold. If you are familiar with Chinese medicine, they have a yin and yang energy, and we condense into just hot and cold. Any disease, you just name it, cancer, or AIDS and everything, it has to be hot or cold. So if you go deep, there are 84,000 mental afflictions, but if you condense or summarize, it can be just into hot and cold. So, okay, this is a picture of brain. There are few chakras which I don't want to go details. Now, today our topic is on the brain. So the brain and its nerves. So accordingly to traditional Tibetan medicine, the brain is the ocean of all nerves, and from which the spinal cord descends. There are 19 peripheral nerves which are responsible for our physical mobility. Out of these 19 peripheral nerves, 13 are called concealed nerves, which are connected to the internal organs, is called internal nerves, and whereas the 6 are called visible nerves, which are connected to external limbs, are called external nerves. I have a picture, but I'm sorry I couldn't get the English translation. Anyone who are interested, I will send you later. The nerves. These nerves channels through which the wind energy and the blood flows is called tsa in Tibetan, which are translated as nerve. So they are the basis of our life, and it is categorized into 4 parts: the formation of nerves, existence of nerves, interconnecting nerves, and life channel nerves. So I want to a little bit go into this. First we'll go to the formation of nerves, which has, I don't know which, it has 3 types. During our gestation, from the umbilical cord, one channel goes up to form the brain, and in the brain, the delusion is located. From the delusion, the lung, the wind is arising. So therefore, the lung and the delusion is dominant in the upper part of our body. And then the second channel is going upward to form the middle part of our body, to form the aorta or the subsequent branches. So due to anger, which is reliance on the blood in the vessel, which is formed in the middle part of the body, the tibba is arising from it. And therefore, the tibba and the anger is dominant in our middle part of the body. And then from the, again, umbilical cord, one channel goes downward to form the male and female organs, and desire is located in the lower part of the body, and the lung is arising from it. Therefore, the lung and desire are located in the lower part of the body. Now, I don't know, even in Indian or other traditional, in Tibetan culture, when we are confused, when we don't know anything, we knock our head. So our delusion is here, and our pagan is here, confusion. And then when we are angry, or when we are aggressive, or our pride, we hit our chest. So the anger is at the middle part of our body, anger or tipa. And then yes, when we are restless, we are nervous, like me, to complete my, because we have a shortage of time, I try to finish it as soon as possible. Then normally we shake the leg, or the lung, which is located in the lower part of the body. Okay. See, I said I'm very, okay. So instead of all these things, I have many, but I have since shortage of time. Okay. So the measurement of the brain function, see, in the Western medicine, we have so many MRI, CT scan, ECG, which Dr. Jens has, and the Dr. Sin has already present in the morning. We do all the diagnosis based on 3 diagnostic procedure, which is like tower, observation, REPA, pulse reading, and TUA, clinical integration. So seeing the tongue, seeing the urine, we analyze and we see what is predominant in our body and mind, or especially in the brain, since our topic is based on the brain. And then we see the pulse, so this is how the observation of the tongue. we see the color and the texture. So I'll not go detail, and this is a urine, analysis. We need the first urine in the morning, and then it has to be in a transparent vessel. And then this is pulse reading, the second one, the pulse reading, the REPA. And then the third one is introgression. So here, see, my thesis is out of these 3 diagnostic procedures, the most important thing is introgression, because the patient has a right to express. Nowadays, when we go to doctor, they don't listen to us. They just go through their report and they tell you, But the patient really wanted to share their emotional. They wanted to share their, suffering, So here, when you give this space, the 50% of problem is solved, anyways. Now, yes, I have a little bit healing, the disorder. So see, after doing this, diagnostic, that lung is dominant or higher in our body, or our mind, or in our brain, the disease like, Alzheimer, dementia, or Parkinson, autism, Down syndrome, bipolar, all disease comes from the lung when it is dominant, or the lung is higher. And the second one, like, when the triple is more predominant or higher in our brain, the disease like brain tumor, and meningitis, something like that, So many diseases based on TIPA. I think I have written here. Yes, brain stroke, and brain hemorrhage. Like that. And then when the pagan is more predominant, or pagan is strong in our brain, then the disease like brain cancer, brain abscess, dyslexia, the one who's not able to, and then mental retardation, she's not able to, all this comes based on how this lung, tuber, and pagan are dominant in our brain. Now, to heal the disorders, for the lung disorder, the best one is, I'll say, the soup. If you are eating meat, the broth, the meat soup is good. Otherwise, just vegetable soup is very good to keep the lung balance. The lifestyle, is, I will say, for the lung is to have a good company, loved ones, singing, dancing, and laughing. And medication, the best medication in the form of we have medicinal butter, or we have a medicinal chang. So it's the alcohol or Tibetan wine. The therapy I would suggest for the lung disorder is based on the oil massage. And then for the tripa, if the tripa disorder, I'll suggest something like a green vegetable or buttermilk, or drinking the cold water. These are very good based on diet. And then relaxation is important. Excessive of gym and hiking are not good. And medicine mat or based on the decoction and powder are good. And then the purgative, for the tripa is very good. And then for the pagan disorder, the best diet is something warm, cooked. And the seafoods are very good, for the kidney failure like that. Strenuous exercise is very good for the pagan disorder, and warm places or hot places are very good. And medicine which are based on the pills or calcinated pills are very effective. And for the therapy, the internal cleansing is very important for the pagan disorders. Okay, so with this time, I have a small, sharing my case history, and then, this is a quick dedication prayer. By this virtue, may I quickly attain the King of Physicians and lead every living being without exception into the enlightened state. So I wish you all be healthy. Thank you so much.
Thank you very much, Dr. Chambayendaba, for a very enlightening talk. Next, we have Dr. Bindu Kodiji. Dr. Bindu Kodiji is professor and the head of the Department of Neurophysiology, National Institute of Mental Health and Neurosciences, Bangalore. She got more than 25 years of teaching and research experience in neurophysiology. Her research areas of interest include neurobiology of Buddhist meditation, brain plasticity, cognitive reserve and consciousness, etc. She's a recipient of Academic Excellence Award by the American Association of Physicians of Indian Origins, SLEEP, AAPOS 2016, and many other prestigious awards. So I now hand over to Dr. Binduji.
Thank you, Gishale. Greetings from Bangalore, and I take the opportunity to thank Venerable Gishale and Dr. Sion for giving me this opportunity to be here, and also I'm really enjoying the sessions. So my topic, in this talk, we are planning, I will be sharing some of our studies that has been going on in the Department of my lab for the past 15 years. So we are trying to understand through this Vipassana meditation studies, especially the neurophysiology of Vipassana meditation studies, we are trying to understand the brain, mind and consciousness, though we are yet to enter into these realms. Right. So I'll be just sharing the information today. You all know that meditative experiences or meditative practices induce intense sensory, emotional and cognitive experiences, and these definitely influence your body and mind physiology or body brain physiology, and definitely enhance the brain and behavior. So what will be the outcome of these techniques? So definitely meditation practices enhance attention, cognition, and also helps in emotion regulation. There is a cognitive induction of these which regulates the emotion regulation, enhances positive affect and regulate negative affect. So there will be just emergence of well-being and positive attitude and the reduction of anxiety, anger and other negative affect. Improve hormonal and immune functions. Enhance parasympathetic activity. So parasympathetic activity is like meditation practices help to modulate autonomic functions. So autonomic functions in such a way to enhance the parasympathetic activity, that is an index of relaxation. So ultimately, you can see that meditative practices help to integrate your body and mind, and thus when the whole brain is integrated, definitely you are much happier than ever. So how? So the question arises again, being a neurophysiologist, we ask, what are the neural correlates of these behavioral outcome of meditative practices? So definitely short-term meditative practices induce or promote relaxation, positive effect, reduces anxiety, stress, improve attention and cognition. And definitely you can see that this is accompanied with a concomitant enhancement of neural plasticity. Many speakers already mentioned about this term plasticity. So we know that the brain is endowed with a phenomenon called plasticity, and the plasticity exists throughout life, because this is nothing but this induces change in the brain organization of the brain circuitry as a result of experience. So here we can use meditation as a tool to understand the experience dependent plasticity. So what are the changes that can be brought in the brain functions? And studies have shown that meditation practices thus enhance brain synchrony, coherence, autonomic modulation and so on, and definitely to bring an brain integration, and thus ultimately it helps in achieving well-being. So there are, before going into the rest, so there are studies to show that meditation practices induces various structural plasticity, and this study is so very important study. This is just to show that meditation practices even enhance the cortical thickness, and it is not that the meditation practices indiscriminately bring or indiscriminately enhance brain thick or the cortical thickness. It is the cortical areas which are very important for attention, interoception, sensory processing. So you see that meditation practices enhances these faculties, enhances attention, enhances awareness, enhances cognition, interoception and so on. So accordingly you can see that brain areas associated mediating these functions are more, like you can see the thickness is more in these regions. Okay. And also other studies like IBMT, this is an integrative brain mind therapy. This is the technique that is utilized in Tai Chi. So where these Tai Chi practices shown to increase the fiber integrity. So fiber integrity increase means it enhances the information processing. So processing of information will be faster among the meditators. So coming to the long-term practice of meditation. Now when we talk about long-term practice of meditation, actually what is happening to the brain and mind or brain connectivities? We say that maybe these kind of practices may enhance the brain cognitive reserve capacity. So that means they make the brain more resilient and thus to utilize the various brain connectivities to mediate the cognitive functions. So brain in normal condition, they say that it is said that we use only 10% of our brain reserve for our day-to-day activities. So that we have a 90% of the brain's capacity as a reserve. So now to utilize this reserve, we will be we are able to utilize this reserve through meditative practices, and thus long-term practices bring. You can study these long-term practices by just studying the various higher mental attributes like heightened sense of well-being, cultivation of altruistic behaviors and so on. So you see that by studying this behavior separately, well-being separately, you will be able to look into the neural correlates or study the various aspects of mind, the various aspects of consciousness. So I'll just skip this. So in my laboratory, the research collaborators are asking few questions like, for example, what is the neural correlates of Vipassana meditation especially the meditation proficiency related neural correlates. So we have studied Vipassana meditation. You all know that Vipassana meditation is one of the oldest meditative techniques, the Buddhist meditative technique. It has been rediscovered by the Buddha, and they utilize the techniques of mindfulness. So here we thought, being a neurophysiologist, we thought we will look into the brain from the sleeping brain perspective as well as from the waking brain perspective. So you can study the waking brain activities, you can study the cognitive activities, cognitive abilities of the meditators, and also you can look into the just sleeping brain, so that you can also study the trait effects, the permanent changes that has been brought by the this intense meditative practices. And we have also looked into 3 categories of meditators, that is the novice meditators, the seniors and the teachers. So the difference between the seniors and teachers, only they are all advanced practitioners of Vipassana meditation, only teachers are involved in teaching Vipassana courses. Whereas novice meditators are just introduced to the meditation technique, maybe less than 2 years, and they would have undergone only very basic course in meditation, not the advanced courses. So coming to the sleep organization, there is another talk tomorrow, so the speaker will be talking more about the sleep and the mental health. So here I will just share only the information that we have seen in our study. So what we have seen is these, this is only the senior meditators. We don't have the teachers. Teachers are introduced later. So here, as you can see, that the green bars, the SWS is the slow wave sleep, and the REM is the REM sleep. So the senior meditators have shown greater slow wave sleep duration as well as the REM sleep duration, and also reduce the intermittent awakenings. So that means your sleep is proper, with quality, with restoration. So it has brought, what we have studied is that these kind of practices, restore proper sleep, and thus restore proper sleep organization, even among the older meditators, like even above 50 to 60 years of age also. Usually you can see a decrease in quality of sleep, but that is not there in these meditators. So these are the major observations we have observed, and also we have observed that when we have computed the EEG waves, what we have observed is an enhanced theta alpha power. So already the speakers have already talked about the alpha power, beta power. So these EEG brain waves, when you classify these EEG brain waves into various frequency based classification, you can classify them into delta, theta, beta, gamma, alpha, and so on. So we have observed there is an enhancement of this power, this particular power within 6 to 10 hertz. That is upper theta and the lower alpha. There is an enhancement of this particular power, especially during REM sleep. I will be talking about this later. So there are various other aspects we have studied. We have studied, in fact, the sleep organization more. We have also published many papers. Then coming to the waking state, we have just recorded EEG when they are meditating. When these practitioners are meditating, we have just recorded using the 128 channel EEG system. Already the speakers have already elaborated. So this is the records what we have got. When compared to the novice and the senior meditators and teachers, you can see the differences. You can see that enhanced EEG oscillations among the senior meditators. So enhanced EEG oscillations, just even with the bare eye, you can distinguish between the EEG activity during meditation between the novice and the senior meditators. And here I just would like to share with you that here, see, when we talk about meditation and meditation associated changes, you have to always keep in mind that the context of meditation is very important. See, for example, in Vipassana meditation, there are different compartment of meditation, as you can see that. So when the meditator enter into Vipassana meditation, so we have just replicated the meditation procedure, what you do, what the meditation practitioner do in his house or in the meditation center. So when you are entering into meditation, you enter into Anapanasati. So Anapanasati is nothing but a focused meditation for breath awareness. So it is a concentrative meditation, and you are just concentrating on your breath, a normal breath. Then followed by Vipassana meditation. So Vipassana is mindfulness meditation. So there will be mindfulness attention to sensations and thought arising from your body. So again, that is also cognitively intense meditation state. So you can see that Anapana as well as Vipassana are cognitively intense meditation states. Whereas when you enter into Metta Bhavana, so you are now concluding your meditation session with a Metta Bhavana. This is nothing but loving kindness. So in loving kindness, you are generating goodwill, and that is emotionally intense. So you see that when you are studying Vipassana and Anapana, it is a cognitively intense meditation, whereas Metta is emotionally intense. So accordingly, definitely you will get different changes in the brain activity. So we have studied, and we have also almost, this is a 45 minutes, 1 hour recording session, and thank you for reminding how many minutes I have. 5 minutes? Yeah, I'll just skip through. So here now we have computed all this, and this is the scalp map. You can see the different colors like red, green, blue, and all this. So what we have studied in a nutshell, I will tell you. So we could see the distinction between the the senior meditators with that of the with the novice meditators. We could see the trait effect, especially the enhanced theta and alpha during rest and metta. Whereas during the Anapana and Vipassana, what we have seen is enhanced lower alpha. So you see the distinction in the EEG dynamics. During meditation, there is enhanced 8 to 10 hertz enhancement, and that is associated with the cognitively intense meditative processes, whereas during metta and during rest. So that means meditation in general enhance metta bhavana, and that is retained throughout. Even if you are not meditating also, there is enhanced theta. So theta is associated with experienced meditation and also associated with well-being, whereas lower alpha is associated with enhanced cognition. We are also, like lot of other studies are going on. I will just, so here you can see that enhanced theta alpha activity is associated with. So you can see that, this can be the electrophysiological correlates of sustained attention, emotion processing, feeling of happiness, reduced parasympathetic activity, enhanced self-regulation, and so on. And here this is, so then from there we have moved to study their cognitive processing abilities. We have observed that these senior meditators are able to carry out these cognitive functioning very efficiently. So when we talk about cognition means it involves various components of cognition, like enhanced attention and sustained attention and working memory. Working memory means the information you are holding to perform a task. And then that conflict resolution, you will be very confused which button to press, but the brain is analyzing all this so fast, and then you are continuing your performance. So here you can see the lower panel. These are the senior meditators. You can see many brain areas are recruited during the cognitive task, whereas in the novice, especially just in initial part of the cognition, around 32 milliseconds, there is no recruitment of activity in the novice practitioners. Even by 60 milliseconds also, you can see more and more brain areas are being recruited among the seniors, whereas in the novice it is not there. Then after 300 milliseconds only, you can see now, so you see the efficient processing of information in these senior meditators. And so this shows that efficiency, cognitive efficiency will be enhanced following meditation. And this is also another important information I just wanted to share with you, that so during meditation we have seen there is enhanced alpha. So enhanced alpha is an indication of alpha gating, we say. So when there is meditation, you are meditating, you are not allowing other processing of other sensory information. So when there is enhanced alpha, it prevents, okay, alpha gating. Whereas when you are now entering into cognitive functioning, you can see that the blue bands, so these blue bands indicate that there is a reduction of alpha. So when there should be a reduction of alpha for cognitive processing, when you are attempting to carry out a cognitive process, when you are meditating, you can see an enhancement of alpha. So this kind of dynamicity, we call it as cortical tuning, is possible only through very proficient meditations. Yeah. So in addition, our main aim is to understand the neural correlates of well-being, but initially we have just studied the meditation proficiency and well-being, psychological correlates of well-being, and here we have developed our own questionnaires using Buddhist, Eastern, the Abhidhamma perspective, philosophy. And what we have observed is there is a very nice correlation between development of wholesome qualities, among the senior meditators. So you can see that when there is a meditation proficiency, there is a change that is happening in your mind, your brain, and that is translated into your behavior. Achieving various aspects of well-being. And so this is in a nutshell. We are trying to understand the various aspects of consciousness through Vipassana meditation. And this is my team, my students' team, working in various aspects of meditation. And my research collaborators, Dr. Ravindra Pant, he is the former director of Navanalanda University. So we are trying to understand, from a neurophysiology angle, we can give empirical information. And we are trying to use this empirical information to understand more aspects of Vipassana meditation and the various aspects of Buddhist philosophy. Thank you so much for the listening.
Thank you, Dr. Vijay. Thank you very much. So now, due to constraint of time, we will have only 1 or 2 questions. And the questioners, I request you to make it a real question, not a comment, or not a lecture. Okay, anyone? Maybe 1 boy, 1 girl? Okay, 1 boy. Okay, Dr. Sandal over there, and then one old lady over there. Okay, 2 of you. And later on, the others can ask questions on other sessions. Okay, Dr. Sandal?
Good afternoon. I am Dr. Indra Jirat, Associate Professor.
I must have. Hello. Yes, Dr. Sandal?
My congratulations to Tibet House and to Vishalaji. From this morning we have heard various issues raised. They are really mind-boggling. But I have been trying to find out, and I think all the audience is trying to find out, the answer to which Vishalaji has put into all of us. And the answer is there a commonality between neuroscientific researchers and what ancient Eastern thoughts have been saying? The mind and the neuroscience. I think, let me decide the 2 issues very clearly. Neuroscience says that, well, okay, consciousness is there, but consciousness is neuron. Consciousness, the impacts on the neuron, we study it, and therefore we say that there is the various aspects of consciousness. Now, on the other hand, what Vishalaji said is fine. Emotion is there. Emotion, passion, anger, they reflect on the mind. So the mind and the brain are definitely 2 different parts. Is that the commonality to find out how is it possible? My suggestion, my question is therefore, the commonality is because neuroscience is bound in one paradigm to which it's not getting out. And that paradigm is, neuroscience says consciousness is individual. And when the individual dies, consciousness dies. My question is consciousness individual or is consciousness global? All the presentations that have been made point to that one single direction. that consciousness to be global. My proof. There is an excellent statement made on the quantum entanglement. Quantum entanglement in physics is a phenomena which goes beyond time and space. It is random. That's why information cannot be done immediately. But if there is a coherence, and then quantum entanglement becomes a phenomena which is a fact. In other words, if quantum entanglement and neuroscience is true, then you have to accept that neuroscience, that consciousness is a phenomena neurologically quantum approved, and therefore it has to be global. Now, if this is mambo jumbo, I don't know, but there is a field of research which I think establishes the commonality between what Dr. G has said and what neuroscientists John and others say.
Thank
There
you.
are other presentations.
Thank you very much.
Dr. The gentleman from Future Medicine, he has talked of basically subjects with emotions having living the body. Now, emotions of others are influencing you. Not only you, but even others. That means it opens, it is proved, it opens a tremendous amount of vista for humanity and for people. No longer you are alone in the world. What others are thinking, what you are thinking, influence the others.
Thank you.
Neuroscience can establish a situation where commonality is solved.
Thank you, Dr. Sam. Wonderful. Thank you very much. The leader with the air. This last question.
I am Dr. Indra Jairaj, Associate Professor and heading the Department of Biochemistry from Tamil Nadu. I have one question to Dr. Bindya Madam. The animal studies, have you seen this human volunteer? What you have shown in the animal studies, whether it will be extended to human volunteers, one question. And another question, majority of our students, they are calling and telling me during the examination time they are not able to sleep, or they are having so much of envy towards their parents, like that. Is there any type of a simple meditations or that which can be incorporated in your curriculum also? I think it is a very basic question.
Thank you so much. See, as far as the brain plasticity is concerned, or as far as the brain cognitive research is concerned, one can study these aspects using human or human subjects or even animals. But the method of, the procedure will be different. For example, we have used in human, we have now studied these aspects of plasticity cognitive reserve using very healthy volunteers of meditation practitioners. So meditation itself is an experience with the plasticity, so you can study the various aspects. So here we use meditation as a tool to understand it. Whereas in animals, definitely one can study various aspects of plasticity. For example, even my own lab, so our question is to understand brain cognitive reserve. So I can use both whether animals or human studies. So animal, I have got various projects running in our laboratory to study the aspects of plasticity and various mechanisms, like we say environmental enrichment or exercise or nutrition. So combination therapies of environmental enrichment, nutrition. So all these play a major role in inducing plasticity and improving cognitive reserve. So we have various models of diseases, neurodegenerative diseases, like models of depression, models of Alzheimer's disease. So we use these animals, we introduce them, we make them to we expose them to these kind of environment and look at whether these environmental enrichment enhance cognition.
Thank you very much. Let's give a big clap to all the three presenters. Thank you very much.
With this, we have come to an end of the second session. Now, may I request Dr. P.K. Sandel, the chairman of ASSOCHAM, to come on the stage and hand over the souvenirs to our speakers as a token of gratitude and appreciation from Tibet House. Dr. Bindu Kuti, Professor James Hussain, Dr. Chamba Indela, thank you, sir.